Good evening. And I want to thank everyone for coming out tonight and participating virtually as well as being in this audience. On behalf of the PHMC Board of Directors, I want to welcome you all. I'm Mike Pearson, Vice Chair, and tonight, concerned citizen, as we all are. And we're looking at what is a critical period for Philadelphia in our time. We have a very important election, and we thought PHMC, like many other public health entities, is concerned. So what are we going to do? We're going to convene a forum tonight, and there's several reasons why PHMC is best suited to group the interests together from the public health community. Number one, we've been a leading public agency serving Philadelphia and the region. And PHMC is the state's public health institute and state health association. And we've celebrated 50 years of expertise addressing social determinants of health, as well as partnering with government, business, and community-based organizations. However, nobody does this alone. And while we're data-driven, we utilize evidence for outcomes, and we also have functioned as a direct service provider and intermediary. It's important to have the engagement of all of the public health community, and that's what tonight's about. And the forum, hopefully, is going to weave together three very important critical topics for Philadelphia: gun violence, substance use, and behavioral health. We felt that, unlike the many forums that you've seen in the news, we've had very little focus on those topics. And the idea is that we must focus on those topics if we're going to address some of the issues that the city faces. Now, that being said, we needed some partners tonight for this forum. And I want to thank WHYY for the partnership, and Maiken Scott for lending your expertise and voice. It's going to be necessary to get where we're going. And we have a facilitator, and Ceisler Media and Issue Advocacy for supporting, and I want to thank them for supporting what we're doing virtually for the streaming and managing the questions and participation for the group. Now, in preparation for tonight's event, we wanted to solicit questions from multiple stakeholders and leadership here at PHMC, as well as providers, community-based organizations, and attendees. So these questions have helped frame tonight's discussion, but we want the questions to continue during the course of our discussion. So please submit them by using the QSR code on the handout at your seat if you're here, and the one present online. And I'd like to also thank the PHMC staff for supporting this event. And you're going to hear a little bit more now from Sarah Molina Robinson, PHMC's Chief Educational Services Officer, and she's going to give you some background on those three critical issues we discussed that are framing tonight's discussion. So thank you.
Thank you, Mike. Good afternoon and welcome. Philadelphia's next mayoral administration, along with City Council, will face unprecedented challenges in addressing public health safety across the city. PHMC has identified three critical and interconnected public health crises to set the stage for this afternoon's discussion. As Mike mentioned, gun violence, drug and substance use, and behavioral health. These issues impact the safety and security of our citizens and neighborhoods. And in Philadelphia, America's poorest big city, these issues are all underscored by poverty. Our goal for progress in these areas needs to include both short-term strategies and long-term evidence-based public health intervention programs, educational programs, community building and engagement, and research initiatives to inform this important work. On the issue of gun violence, we know that gun violence in Philadelphia is concentrated in a handful of city blocks, where the poverty rate and the rate of vacant housing is higher than the city's average. In PHMC's social service and education programs, we've witnessed children and youth experience the trauma of losing family members to gun violence, and we've also experienced the loss of some of the youth that we serve. In 2021, the year that the city set a record for overall number of homicides, juvenile homicide 3 times higher than in 2015. Gun violence is a public health crisis that impacts everyone. However, we see greater impact in communities of color and those experiencing poverty, housing insecurity, and lack of healthcare access.
Whew. Okay, so you're all with me? This works, and we're gonna get started. And again, our timers up here are gonna do their job and do the thing. Our first topic for this evening is the issue of gun violence, and that will be addressed to Group A. Okay, so gun violence for Group A. This is obviously one of the biggest crises affecting our city right now. And to get us into the topic, I am a journalist, so I wanted to tell you a story. We recently hosted a story slam at WHYY together with the College of Physicians, and we invited both community members, people who had been affected by gun violence, and physicians working in Philadelphia hospitals to tell their stories about how gun violence impacted them. We had an ER physician who told us about a patient who came in who had been shot in the neck, and she and her colleagues worked tirelessly to save this person's life, which was very difficult and on knife's edge. The person survived. She was able to tell that young man's mother, "Your son is alive." And the man ended up recovering. He left the hospital. 2 months later, he was back. And this time he did not survive. And this time another physician on duty had to tell that mother, "Your son has passed away." So that was something that we heard from physicians again and again, just how frustrating it is to put all this effort into this work. On the same night, we heard a much more hopeful story from a gun violence recovery specialist named Rodney Babb, who had worked with a young man who had been shot in a case of mistaken identity. He was seriously injured. He was now very scared. He was unsure of what to do next, and he was ready to drop out of high school because he didn't even want to go anywhere. So Rodney worked with this young man, got him into all kinds of services, helped him recover in every meaning of the word, not just physically, but mentally. And that young man is now involved in a really strong VOTEC program and is really set on a path toward a promising future. So I say all of this to say that intervention can work. We've seen it work. And we want to know from the candidates in Group A, thank you for joining us, the candidates in Group A, we want to know, what is your take on gun violence intervention? What works? What doesn't? What would you do more of? And we're going to start our 2 minutes with David O. So, thank you.
All right, thank you very much. We have reached the point of horrific gun violence. It's unprecedented in its nature. We've had violence in the past. We've had gang wars. But even in those days, we've not had 15-year-olds looking for another 15-year-old to murder, not finding them, being satisfied to shoot someone who just appeared in a social media picture with them, or their mother, or their little brother. We're at that point, not in every neighborhood, but that is a very important issue as we look at how to resolve gun violence and murder. So the first thing is we have to provide a completely different process for assuring people that we care about them. First of all, that we care about their lives, and that means policing. There's no other way than to provide visible community policing in the neighborhoods and communities that want it, that are afraid for their children's lives in almost anything that they do. And by the way, how many people are buying guns now in this city that never wanted to buy a gun? And we know some of those numbers, so it's increased dramatically. Once we have done those type of things, providing better school police security, providing safety in public transportation, reversing many of the policies that have led to a level of lawlessness and invited young people to think that they can do all kinds of things that run them into conflicts and problems, we will then be able to deal with gun violence. The intervention, however, comes from a very particular group of people to the extent that it's effective. These are people that typically do not have a master's degree, have 8 bullet holes in them, have street credibility, and go about interacting with these young people in a way that's meaningful and sincere on their part. Tie that in with our system and with other more academic providers, and we are able to do something about the murders.
Thank you so much. Up next, we have Jeff Brown.
Good evening. The gun violence problem to me specifically is about 1,700 people approximately in the city that have a criminal record that we've attempted to prosecute in the past and we failed to do it. So I see it as a problem of evidence. And the way we address this is we need to invest in our forensics because our forensics are deficient in Kenny's current budget. He has a big allocation for forensics. I think that's a wise investment. And the second thing is gunshot cameras. So in the neighborhoods where we know there's violence, we need to have gunshot cameras. They're the kind of cameras when it hears a gunshot, they swing around and video record the episode. That's the evidence we would need to prosecute someone. Because in my mind, if the 1,700 people are off the street, we have a massive reduction in gun violence. So that's part of the strategy. We are majorly understaffed in police. We've lost about 25% of our force. Very hard to give us safety without a visible police presence. And there's a plan in my mind to restaff the police. You can look on my website for that. But the other is young people. How do we have an intervention so young people have positive things to do? And, you know, I have 4 children, and my wife and I kept our 4 kids so busy, they're just going from activity to activity. And in the poorest big city in the country, the city needs to help with this, which means rec centers have to be in good condition and open. Libraries need to be open with librarians. Pools need lifeguards. Philadelphia Youth Network needs to be fully funded so every young person who wants a job in the summer can get it. And that's how you get young people going in the right direction.
Thank you. Up next, we have Helen Gim, please.
Good afternoon, everybody. It's a pleasure to join people, and I'm honored to be here. I'm running for mayor to make Philadelphia the safest and healthiest city in the country. And I believe that cities have to lead consciously on that effort. In a city where there is a 20-year life expectancy difference between zip codes that are merely half a mile apart from one another, we have to understand that the problems in Philadelphia are not merely accidental, and they are not merely due to the fact that there are individuals who are suffering. It is, whether intentional or not, a city that has left its health and its well-being of its residents behind. And thus, everything has to change. On this stage, there'll be plenty of people talking about how to respond to gun violence or how to manage a crisis. I am not here to do either. I am here to prevent and end gun violence with a serious investment in communities, in young people, and in our neighborhoods. I've made it very clear that from get-go, on day one, I would declare gun violence a public health emergency. And it's important that those things go together. In part because in a city without a large public hospital network, we have to knit together a wide variety of private providers, city agencies, and individuals who are on the ground on an all-out public health mission to save lives, especially for young people. I absolutely believe in group violence intervention. I have seen it work. What we need to do is be a lot more coordinated about where it takes place. Hospital-based intervention systems are touch points. Our juvenile justice center, where many young people go in for the very first time, are important touch points. But we need a case management approach to young people. And then finally, I need to see a crisis response effort that is beyond policing. Crisis response is meeting the mental health, housing, healthcare, emotional, educational needs of residents and of individuals who are suffering from gun violence so that we can prevent crime and not just punish it.
Thank you. Now, we have Warren Bloom joining us. And I'm just going to repeat the question just because you were just getting
Thank you so
settled
much.
in. So the question to the candidates in Group A is, what is your take on gun violence intervention? What works? What doesn't? What would you do more of? And you have 2 minutes to answer this question.
First of all, good afternoon, everybody. Thank you all for coming out. As a mayor, first of all, the mayor's job is to administrate, delegate, and create policy. This is actually an attack on the home. Our homes are being attacked. Society is simply made up of families. So when you corrupt the family, you've corrupted society. We're going to talk about parental education. And as a minister, and I believe the mayor should be sort of a spiritual father figure. And I want to remind us that we are the city of brotherly love, sisterly affection. I'm on the love frequency, and I'm not coming down. I'm the only candidate who's committed to going into certain districts and setting up satellite offices to deal with a lot of these issues firsthand and one-on-one. I want to lead by example. Also, since I have a background in media, we're going to be launching public service announcements full thrust on positivity, creativity. We have to change the mindset of our citizenry. So through repetitive ads and working on positive affirmations, and this is the last thing, you. And somebody said, point to yourself, point to yourself. You have to help me do this. I'm the only candidate saying I'm going to be inclusive. I can't do it all. No one person can do it all. The mayor doesn't know everything, but I'm going to ask the citizenry to help me govern and solve this issue. There's no more Santa Claus, and public safety is everybody's responsibility, not just mine. Thank you very much.
Thank you. All right. So everybody, thank you for staying within the time limit. I appreciate that. So now we're going to pivot to question number 2, again for this group, and then it's your turn. This time we're going to start in a different order. And here's my question. The approach to gun violence intervention, to many of the strategies that all of you have touched on, is fragmented. So how would you envision community organizations, agencies, institutions all working together on one policy, pulling on the same strand, basically? How would you do all of this in a more holistic way, in a more coordinated way? This time around, we're going to start with Helen Gim. So 2 minutes again.
Thank you.
Sorry.
I can hear you.
So I would, for gun violence interruption, I think one of the most important things, again, is to have a focused view on where young people, and especially those who are involved with gun violence, actually touch systems. One of the things that we know very quickly is that when young people come in, and once they're with us at different points, whether it's in a hospital emergency room, whether it's in the juvenile justice center, whether they're calling 911 for help around a domestic violence emergency, you've got them for that moment. And then if we let them go without a plan, they disappear. It's hard to find people. So it's been very important for me to have a coordinated, all-effort approach towards young people whenever they come in and touch places. It's one of the reasons why I think the hospital-based intervention program needs a lot more support from the city end. It's not just about a hospital ER, a doctor that does the emergency wraparound. They should be able to coordinate immediately with the school system that's been receptive and responsive, with a housing effort that's been receptive and responsive, and with a Department of Human Services that is also receptive and responsive. I think it's also really important for us to take a look very carefully at the Juvenile Justice Services Center. These are young people whose families cried out for help long before those young people ever step foot in the door. And we do so little for them as soon as they leave. They are leaving in different states of distress and in need. And we do absolutely no needs-based assessments of them. We do not coordinate with our municipal courts. Before I left City Council, I was pushing on a big effort to involve municipal courts, community organizations, wraparound services, so when young people and their parents, so that when young people left, that they weren't leaving without a plan. Too often, we just hand them over to probation. I think when we have done these things in a strategic way, we have seen differences happen in young people's lives and support the resilience and character of young people as well.
Thank you. Now we're going to go to Jeff next, and then Warren.
All right, so I talked about gun violence, but we're talking about people that already, it's gone way past when it should have. The idea is to have early interventions. And we're the community-based organizations, the public health organizations get involved. They interface with people. And if someone's in crisis or they're going down the road to being in crisis, we need early intervention. And that's behavioral health. We know we have a behavioral health crisis. It's substance abuse. We know we have a substance abuse problem. And it's young people that don't have what they need. They're struggling. We know that in school because we see signs. And the idea is we need to meet our citizens where they are. And when they're struggling, we need to get them help in the early stages so we can avoid them being in the criminal justice system and wreaking havoc with their lives. And so I think the number one thing that the people in this room could do is let's build a comprehensive early detection system that we work together on. We collaborate with each other and get people the help when it costs a lot less and where there'll be very little harm to the person if we could help them very early in the process. I think that's what we should be thinking about. And like you had mentioned, we have a very fragmented system. We should be thinking about how we can work together, almost like a public health record, you know, for people that are struggling, where we can share data to the extent possible under the law and work as a team to address these crises.
And in the 30 seconds you have left, do you have any ideas as to how to consolidate or how to get that cooperation to start?
I think consolidation won't happen without the government. I think that the city of Philadelphia, whether it's the Department of Health, which I think is where it belongs, needs to set the basis in which people cooperate because they're kind of competitors. And someone needs to tell them it's time not to be a competitor. We're going to work together. We're going to figure out the math of the whole thing. I think this can be led, and it should be a city-led opportunity.
Thank you. Now, Warren, your turn. And again, 2 minutes, please.
I concur with Jeff and Helen, Alan. All of us, not to be rhetorical, have some of the same ideas. It's about adoption. And I've told all of them as mayor, I would adopt most of their ideas because I'm not going to despise the wisdom of Mr. Green here and David O. Everybody has some great ideas, and I told them I would help adopt these ideas. I've never been a hater, but we all have to work together to solve this problem, and that's what a leader truly does. He has to have the personality to bring people together to work together effectively. So I concur with most of the ideas that each of these candidates have, and we've talked about this before, but I'm going to work together with all of these candidates and use their ideas and put them into action, and we're going to get this thing done.
Thank you. And now we're going to turn to David for the same question.
Thank you. If we look at our entire city, many of our neighborhoods don't have these problems, only certain neighborhoods. And when we look at them, we could see the failing of government, the failing to do what's constitutional, required by law. These are not anything new. The schools are underserved, under-resourced. The libraries are in bad condition. The public spaces are dirty and dangerous. The neighborhoods are unsafe. So the first thing, once we stop the bleeding, stop the violence, we have to show in a very immediate and visible way to people in the community that we know they're there and we care about them. They have to see immediate action. One of the easiest ways is by cleaning up the community, greening it, and beginning projects there. The next is I am for reforming the school system because that school system really should be more responsive to people in areas where there is poor quality education that has to be improved. There has to be vocational training in it. There has to be things that the young people want themselves, like the creative arts economy and other opportunities. And that has to tie into a clean and safe public transportation system. These things are things we can do. Then we can bring in our service providers, our mental health people, our drug addiction counselors, and others to begin working in more specific ways with people in the community, from parents to grandparents to children themselves. But I think the most immediate thing is to show people that we are transforming this system from one that has neglected them to one that cares about them.
And again, you have about 30 seconds left. How would you orchestrate those services to work together? These are all different things you just mentioned, but they have to work together at some level.
Sure. I think, for example, when we look at public spaces, first, I would have 9 new members of the school district. I would love to see the school district divided into 5 different zones where people can ultimately elect a representative from their 1/5 of the city to tailor a little more to what's going on. There has to be like very clear changes, whether it's new buildings or restoration of buildings, removal of items, longer school hours where it's needed, summer learning, summer enrichment, and tie that in with new libraries. The libraries they have to be reimagined. There should be 3D printers, rent a violin, rent a guitar, and have young people be able to build through credit in their library card the ability to take out quality items overnight or for longer periods of time. But all these things are being eroded and removed from the culture of these communities.
Thank you. Thank you all so much. Those were the responses of Group B, the answers from Group A. And now we're going to turn things around. And this time around, we're going to start with the candidates in Group B. Yes.
Did you want to?
What's up? This was just a response, and now you get your own questions, okay? But your questions will be on the topic of the opioid crisis and substance use more generally. This is another major topic that affects the city of Philadelphia. I don't think I have to tell anybody in this audience about the horror that is affecting different neighborhoods in our city in terms of the crisis around opioids. Sometimes it feels like when you travel to different parts of Philadelphia, you've landed on a different planet where you see suffering as far as the eye can see. I follow a Facebook group that is for parents who are searching for their loved ones who are somewhere in Kensington, or they think they are somewhere in Kensington. They often haven't seen that person in half a year, in a year. These people are mothers, they are fathers, they are brothers, they are sisters. They are desperately missed and they are lost somewhere. But as horrible as all of this is, we also know that intervention, again, can and does work. Recovery is very much possible through the right kinds of intervention that come at the right time. We recently featured a man on The Pulse who is an outreach worker. He himself was an opioid substance user for years, decades. He became sober through one of the Philadelphia agencies and then later became an outreach worker for them. He remains in therapy. The work is very hard for him because through his work now, helping other people, he's constantly exposed to the very problem that he has dealt with most of his life. Yet he goes back every day to do this work. So recovery is possible. We see it work. So my question to the people in Group B is this: what are your solutions to address the opioid crisis, both systematically and individually? What do you think are the best approaches in terms of getting people onto a path of recovery? What helps them? So in random order, you have 2 minutes. We're going to start with Derek Green. So again, what is the system-wide approach? What's the individual approach? And what helps in terms of recovery?
So when I think about the issue of opioid addiction, and someone who, as chair of the Council Committee on Disabilities and People with Special Needs, I'm very familiar with a lot of the issues, especially related to behavioral health, having a child on the autism spectrum. And I've spent a lot of time over the years, both in city council hearings, but also walking streets and being in the streets of Kensington, both from a public safety perspective, when I've done late night ride-alongs with a 24 police district, but also talking with Bill McKinney for NKCDC and Casey O'Donnell for Impact. And I think the issues that I see right now is that there really hasn't been real leadership, just like we didn't have leadership with the water crisis. The fact that we've allowed Kensington, and I'm listening to your comment earlier, look like a scene from The Wire is really troubling, that we have not had real leadership to address the issue and look to our federal, state leaders and also resources to help with these issues in our city. When years ago, when they cleaned up Gurney Street, for those of you know what Gurney Street looked like, but there was no plan after that. There was no plan to provide additional assistance. For example, medical assistance treatment facilities and locations to work with people who needed real assistance. So we have not seen that. We also have not seen a real reach out to our federal and state agencies to help us know in that regard. But it cannot be a top-down approach. It's got to be an approach working with the community and the leaders. And unfortunately, we have people from outside the city of Philadelphia coming into the city trying to provide services to many people who may actually came from outside the city into Kensington. So we have to be much more consistent and also work in a real communicative process and working with the leadership in Kensington. Right now, I know that Casey and Bill actually have a program working and talking with residents and neighbors and business owners. We should be supporting them. So it's not about me as mayor coming in and say, dictating what's going to happen. It's actually providing the support and the services, but not allow what's currently going on to continue to be how it is, but provide the resources and the support and look for other programs around the country. And as a national president of Democratic municipal officials, I bring some of those best practices to work with our community leaders to solve the problem, but will not allow it to continue to be like a scene from The Wire.
Thank you. Rebecca, you're next. Same question.
The status quo is completely unacceptable with the situation in Kensington and across our city as it relates to the opioid crisis. I put out an opioid plan, which is on my website, rebeccaforphiladelphia.com. And as mayor, I will enact the steps contained within that policy. So first, there is a law enforcement component to break up the open air drug market that is existing in Kensington. We cannot let that continue. At the same time, we need to provide compassionate care from those suffering from substance use disorder. From a city perspective, we need to do a much better job coordinating the city departments. I've seen working for the city, I worked for 2 different mayors for close to 10 years before running for city controller. As chief administrative officer, I oversaw the back office function of the city, about 1,000 employees. And I saw all of the siloed nature of the departments and worked to break that down. So on the opioid crisis, we have Department of Behavioral Health working separately from the Department of Public Health, from Homeless Services. We need to make those departments work together to have outreach, to make connections, because from an individual level, what works is making that connection on the ground, developing that relationship, and pulling that person into treatment when they are ready. And we also as a city need rapid intake because there's no reason that someone should wait if they're ready to get help. Thank you.
Thank you. Alan Dom.
Thank you. You know, as your next mayor, something I've learned over the 40 years I've been in business and almost 2 terms on council is that I'm never the smartest person in the room, never. And there's a lot smarter people outside than I am. And I would engage, whether it's PHMC or any others, to help me with these issues. Because this is how we're going to solve these problems, bringing people together around the table and getting these problems solved. There's a lot smarter people in this room on these issues than me. I'll just share with you what I did, and you can judge it, but I'll also share with you that God gave me 2 ears and 1 mouth, and I try to use them in that proportion. But I go to Kensington a lot, and I actually picked up the phone back in January of last year and called Governor Wolf and said, Governor, this is the worst situation ever in any part of the country. I said, why are we not declaring this a FEMA site? Because when you have a hurricane, tornado, or flood, it's a FEMA site. You get federal, state, and local aid. This is worse. It's been 20 years. We have more deaths from opioid addiction than we have from shootings. He said, well, there's no category for that, but if you put in a resolution for that, I'll talk to the president about it. The mayor's got to give me a call. My colleagues on council supported my resolution for 3 things. 1, to work with federal, state, and local law enforcement, drug enforcement, and community partners on the ground, like NKCD and others, to come up with a plan on stopping the drug dealing, getting the people into treatment. There's like 862 people last year that were on the streets of Kensington. 60 to 70% were not from Philadelphia. Maybe getting them back to where they're from with their homes and families and get them into treatment there and get the Philadelphia people in treatment here, but getting that help. And then the third part was to bring back and revitalize Kensington, having the city pay for it over the next 5 years with a special services district to bring back that neighborhood. We put in the resolution. It was passed unanimously. All the mayor had to do was pick up the phone and reach the governor. We had 2 calls scheduled. It never happened. That will happen when I'm mayor.
Thank you. For our second question, there are now some settlement dollars that are going to come to the city, maybe are already coming to the city from the settlement pertaining to the opioid crisis. What are your thoughts on how you would prioritize using that money and how you would keep the process open to both the communities and the provider organization already doing this work. If it is possible for you to roll into that answer some thoughts on treatment, what kinds of treatment you support. There are different schools of thought on medication-assisted treatment, on other forms of treatment. So give that maybe some thought in your answer, if at all possible. This time around, we're going to start with Rebecca.
So the settlement money represents a big opportunity to get additional funds to help tackle this issue. So first, I would want input from stakeholders such as yourselves into what your ideas are. And as mayor, what I'll do is look at what's working on the ground and scale that up. Allow the community members and what's working on the ground, the providers that are doing the work, if it's working, we should be funding it. That's the way that I look at problems overall, and it's the way that I'll address the settlement money that's coming in. In terms of treatment, I support MAT, medical assisted treatment. I think that people get medication to deal with issues such as diabetes and other illnesses. We need to look at substance use disorder in the same way. And I defer to the experts in this topic, but to me, in my administration, I plan to hire the best people. And in this topic, I will lean on experts to develop the processes and practices and interventions that work best, because our goal is to get people away from their addiction to a healthy life. And the people that know how to do that best are likely in this audience and in the field in general. And that's who I'll lean on for my answers. Thank you.
Thank you. Derek Green.
So earlier I talked about some of the work that Casey O'Donnell and Bill McKinney are doing at a very grassroots level in Kensington. But when I think about how we address this issue, and it's been a very siloed approach, unfortunately, I'm thinking about what happened, the aftermath, the unfortunate situation with Danielle Kelly, and how for the first time from my experience, I saw all the different agencies within the city, as well as local stakeholders and community-based organizations all working together, talking on a regular basis about the issue and the welfare of children going forward. So I would take that same type of approach to deal with this issue and to use those dollars, but also bring in federal and state partners as well. And also some organizations you would not necessarily think about, like the Commerce Department, to help bring back some of the small businesses and also help provide some of the services in the community like we see at Center City District. But we'll do it in a community-based approach, using the lead that's happening from the communication from the residents and the people in the community, but also providing the additional support at the federal, state, and local level, some of the agencies who have not been involved in that perspective. Because I think it needs to be a very interdisciplinary approach, which is not what I've seen. And too often, these conversations are too siloed. But we need to make sure that we're going forward, we're leading with the local residents and business owners and their perspective, and we're providing the federal, state, and local support to make it happen, but also do it in a way that provides real accountability and transparency so the residents know these are the steps that are being taken, when it's going to be taken, how it's going to occur, and the follow-up. Because too often, and when I announced my campaign last year, I said Philadelphians should expect more and deserve better from our city. And my concern, if we don't have the right leadership, we'll have the same situation again where dollars come into the city, we'll see an attempt, but we don't see the accountability, and then people will be wondering what happened to those dollars, and we're still in the same situation that we've historically seen, especially in what's happening in Kensington.
Thank you.
Thank you. This may sound a little rough, but Kensington's an issue of supply and demand. If we can cut off the supply, we can help the people who have the need or the demand. And until we cut off the supply, they give out free samples on different days of drugs, and they're really good entrepreneurs. They're just in the wrong business. But until we completely stop the drug dealing, this problem won't go away. And we have to restore Kensington. And I don't mean to stop it, to move it to Bridesburg or anywhere else. I mean to take it out of the city. That's the commitment I will have, is to stop the drug dealing and make sure the 860 or so people get the treatment. I think the opioid settlement is about $200 million over the next 18 years. That's not really a ton of money. And look, I would declare a public health crisis day one in Kensington. I'd work with community partners to help us with housing and all the issues that are affecting Kensington, including harm reduction, prevention, education, housing, and the trauma. How about if you live in Kensington, you have little kids and you're walking up to McPherson and they're stepping over needles to get to the library? It's unacceptable. That would never happen in Center City. We won't allow it. This has been our fault. We've allowed Kensington to be a containment site. Like it's okay to go there and do drugs and sell drugs there. It's unacceptable. And under my leadership, I will put an end to it.
And very quick follow-up. Your approach, are you talking about stepping up law enforcement? How does that look?
Well, there's three parts.
Yep.
One is federal, state, and local drug and law enforcement with community partners to stop the drug dealing. Two, get those people that are on the street into treatment, if we can do it here or where their families are back home. And three, the city invests $5 to $6 million from K&A down to Lehigh, 2 or 3 blocks in each direction, creates a special services district that the city pays for the next 5 years to bring it back.
Thank you. All right, now we're going to ask the candidates in Group A to respond to some of, yes, let's switch the microphones. Thank you. So we're going to ask you to respond to some of what you've heard. Again, in 1 minute, we cannot respond to everything, but I'm sure we've gotten some good ideas here. This time around, we're going to start with David O, please. So 1 minute.
We cannot let perfect be the enemy of good. There is no perfect solution to the problem in Kensington. What is perfect for one group of people is not perfect for another. The first group of people we have to be concerned about are the residents, the children, the homeowners, the people who live there. And the fact that they have to deal with lawlessness, violence, murder, drug dealing and drug addiction, public defecation, people living in tents. It's all very inhumane conditions. And it's been created by the city's policy of enabling, which also includes the idea that drug addicts need drugs and they're not arresting drug dealers. There has to be law enforcement that removes the idea of Kensington, because Kensington is drawing in so many more people to be victimized in this city than if they remained at home and got the help they need with the dollars and resources in their own communities.
Thank you. Now we're going to go to Helen Gim, please.
Well, I will lead as mayor a coordinated effort to make sure that we also end the open air drug markets. I think all of us can agree with that. But the key here is to bring Kensington back into a place of resilience. That is the whole city effort. That is the public health mission that many of us in this room fundamentally believe in, that it's not just about making bad things go away. It's restoring back neighborhoods for neighbors, making sure that our parks and rec centers and libraries and civic and public spaces come back to life, that we have crisis outreach that is better than in any other place. And we bring people back into diverse places of recovery, which includes housing plus recovery services, that we have a health-centered approach to supporting young people in particular, and that we're deeply invested in the mental health and supports and cleanups of the city of these neighborhoods. Resilience hubs is where this city needs to come together to form a real mission to restore back neighborhoods for neighbors.
Thank you. Jeff Brown, please.
Yeah, there's a few things that I didn't hear talked about, so I'll bring them up. When I was on the convention center board, we had 70 or 80 people, unhoused people living under our tunnels, most of which had substance abuse problems. We struggled with it for years, and we had homeless services go and discuss with them in a very human way that they can't stay there. We don't want them to move somewhere else. We want to help you. How can we help you? And, you know, the people were part of the solution, and we got all of them into supportive housing and treatment. And it started with, first of all, assigning it to a group, homeless services, and second, working with them. Second thing is they do commit crimes in a lot of cases, and that gives us an opportunity to send them to drug court. And in drug court, it's a very effective way to have a good outcome because you monitor their substance abuse. If they fall off the wagon, they have a choice. Do you want to go to jail for your crimes or you want to go back to treatment? And I think there's not international studies that show that court administered treatment like that has a much better outcome. Those are things I consider. Let's educate our kids in school also to learn what happens if you have a substance abuse problem. So maybe we can get some kids to think about not doing it.
Thank you. Warren.
Again, I was the first person to visit Kensington, the first candidate after I did it, everybody else ran up there. But again, I'm the only candidate says I'm committed to having a satellite office in the heart of Kensington. Kensington is a microcosm of what this whole city look like if we don't take a serious look at this. Again, everybody don't have the same skill sets that I have, but I want to deal with these individuals one-on-one when I can to minister them. And the big picture about everything we're doing here in the 20 seconds I have left is I'm telling people to pray. Pray for your, if the worst thing I can tell you to do is pray for your city, don't vote for me. But prayer is going to play a big part in solving this problem.
Thank you. Now, we're going to move on to our next set of issues, and I'm only going to ask one question here, and each candidate will have 2 minutes to talk about this issue. So the issue that we're pivoting to now is behavioral health. I was a behavioral health reporter for many years, and sometimes people would ask me, well, what do you report on? And I would answer, I report on everything. And I meant that because behavioral health is part of everything that we do, every aspect, whether it's politics, whether it's medicine, whether it's Wall Street, it does not matter. There is a behavioral health aspect to that issue. And of course, that is true for the topics that we have talked about today already, gun violence with all of the trauma that is involved. And of course, substance abuse is a major mental health issue. So we want to talk about other behavioral health issues that affect so many people in Philadelphia. Trauma is a massive topic. There are behavioral issues such as ADHD, autism, that often get kids on a very difficult path where they cannot succeed in school and they don't have the resources that they need. Now, the behavioral health services in the city are largely handled by CBH, Community Behavioral Health, and that agency has 3 main objectives: access to services delivered in quality, effective manner, and fiscal stewardship. Right now, a lot of the provider organizations are facing a tough crunch because they have increased demand for their services and there's less money to go around. Some of them are now facing decisions to have to close services. So if we go back to these 3 objectives, access to services delivered in a quality manner, and fiscal stewardship, how would you as mayor ensure that that is happening, that people have indeed access to the services that so many people need? This time around, again, in a totally randomized order by my computer, we're going to start with Rebecca Reinhardt, and we're going to have 2 minutes. Thank you for sharing the microphones.
So the issue of behavioral health is incredibly important, as all of you here know. As mayor, I will make sure that our residents get the services that they need. With gun violence levels at record highs, we've had 3 years at or above 500 homicides. We were below 250 homicides just back in 2013 and 2014. That level of violence is traumatizing. And we need to make sure as a government that we are providing behavioral health support, therapy, trauma treatment to individuals that are around the violence that before and during issues, so that it doesn't keep impacting people throughout our city. Because we all know that trauma has all of these other impacts that the people, they're numb up and can't focus, and all of these other issues that have ripple effects. So as mayor, I will put a big focus on behavioral health. As city controller, I audited behavioral health. The city spends over $1 billion of federal and state money that flow into the city on behavioral health on over 270 providers. That is a lot of money, but somehow it doesn't get to people when they really need it a lot of the time. And that is a question that I think still needs to be answered. And as mayor, what I plan to do is to make sure that there's rapid intake programs, that there's therapists available when people need them. We need to look at the overall service delivery. I know there's been years where the city has sent back tens of millions of dollars because it has not it has not matched it up correctly. I know that from being the budget director. So as mayor, I will make sure that we get every dollar we can from the feds and the state, and that it is matched up to providers to provide the best services to the residents of our city. Thank you.
Okay, so I'm going to give each of you a little bit more time on this question as well. And I do have a quick follow-up question. So are you saying we have the money, we're not spending it wisely? Or are you also saying we also need more money and we need to spend it more wisely?
I'm saying if we get $1 billion, that as mayor, the first thing that I'll do is make sure that it's spent wisely, and that we're getting every dollar that we can. That would be the first step. I'm not convinced that we're not getting enough. Now, if that becomes clear, then I will deal with that situation as mayor, because I will make sure that our people across our city get the treatment that they need.
And is there a specific way in which the money is currently not being spent wisely? Can you give a very brief example of that? Like, how is the money not being spent in the right place?
That's a question that's hard to answer without getting someone in behavioral health to fully explain and break down the process of 270 providers. There's money that comes in that, as I said, sometimes gets sent back. There needs to be a fuller discussion, evaluation, and as mayor, I would do that. I'm not convinced we need more money. If we do, then I'll advocate for it. I'm just not there yet, and I'm being quite upfront and honest about this.
All right, fair enough. Thank you. And again, I will do a little bit of follow-up with each of you on this question, just because it's a really complicated subject matter. All right, up next, we are going to go to Warren Bloom. So how would you ensure that people have access to behavioral health services when they need them?
Well, the Philadelphia Department of Health's job is to make sure these agencies, the citizens receive the services they need. I'm going to be working heavily with them and also instructing and delegating to those who are more expertise on how to get these services to the citizens. But again, we're going to do everything humanly possible to solve all these problems in the city. And again, I'm asking for the public's health. If you go to my website, to send in ideas. My phone number's on there. I don't know how long it's going to be on there, but if you can text me and give me some good ideas, you are going to help us solve these problems. But I'll be willing to use and work in the Philadelphia Department of Health to get these issues and resolved.
Can you give me an example of an approach that you have seen work, that you would do more of, that you think is effective?
Well, again, I'm going to do more research on that, and I'll get back to you when I find the answer.
All right. Thank you. Fair enough. David O.
Yeah, I think if we provide better services, if we take care of the things we should as a city, education, jobs, prosperity, that solves a lot of the portion of these problems through private insurance, public insurance, things like that. Where we could really kind of focus are on the folks that come up to us as being the most in need. We find them in domestic abuse court. We find them in juvenile court. We find them in our prison systems. We find them in our schools. And one of the things, as a former prosecutor here in Philadelphia, I will say is the offender is far less than the victim. There are many more victims than offenders, but the offender is eligible for group treatment and other types of services, but most often the victim is not. Whether it's a victim of rape, child abuse, they oftentimes receive no services and they grow up to be traumatized adults. I think there's a lot we could do when we identify the individuals who need mental health services, trauma-related services at the early point, and provide those services. You know, we all have some issues, but they have issues that they have made contact and are most likely to be impacted and to impact others.
Now, again, we have a little bit more time on this question. So you have spoken about schools several times now. Would you expand school-based
Sure.
services? How would that look? How would you fund it?
I would expand it. I just had a program last summer for children who were bullied and beaten in school. We had about 200 kids sign up. Now, the school's policy nowadays is if you get a beat down in school, I'm not talking about name calling, I mean physically beaten, the bullies are not removed from school. And so the child must go to school with the same children that gave them a physical beating. They're opting for online school. They're traumatized. They feel unappreciated, their community, their parents. And so the school should do something to step in like an adult and deal with the problems of the children who are beating other children, and the problem of the child has received that beating oftentimes posted on social media. That's a good place to put this money and these efforts.
And one last question, in terms of the budget, this is, behavioral health is already a massive budget post in the city of Philadelphia. So how would you allocate that money? Would you spend more? Would you try to spend it differently?
Well, I would spend more, but I would spend it differently. Again, I would focus on the people who are most damaged and most likely. We can predict what's going to happen to them. A child who has been sexually abused is more likely to be an abuser of children sexually. We can spend that money to try to save them as quickly as possible.
Thank you. Now we're going to go to Jeff Brown. Thank you.
Good evening. If you notice, we have an overwhelming number of problems. And a lot of times we talk about how much money it costs when things have gotten really bad, but still continue to leave very neglected people. And so I want to move in a little different direction in this conversation. We know we're the poorest big city in the country. We have a massive poverty problem. I will tell you that this is a big part of our behavioral health problem. Very hard to have good behavioral health in a very extremely impoverished family that's been structurally impoverished for many generations. And I would surmise to you that most of us have at least some amount of trauma or problems. And part of the therapy is to make a living, go to work, have friends at work, and feel good about yourself and good about your family. And part of the solution is to help people do that. And so I really think that's important. The second thing is our built environment's a mess, especially in the neighborhoods. It's a downer to see trash everywhere and dumping. It's a downer to have potholes and boarded up homes and graffiti, and that needs to be addressed. If you don't address these things, we're going to need an unlimited amount of behavioral health dollars. Now, as far as the behavioral health dollars, we're for the most part treating people like we always have, and we're not looking at it systemically. I mean, are we offering enough interventions early, like education in schools, how to deal with different things, education in the workplace, how to deal with different problems? We're waiting too long to address problems, which makes them really bad. And are we using online? Are we looking at efficiencies in providers and considering consolidation to reduce overhead? I mean, my understanding is the behavioral health department this year has a $1.6 billion budget, primarily funded by Medicaid. It would seem that that's a lot of money, and we should be able to make this work. I think we have to take a harder look at it.
But it sounds like you would also advocate to broaden our perspective on what constitutes behavioral health services and to think beyond literally mental health services.
Yes, I want to fix the problem at the root, not when it's very expensive many years later and we're in crisis. And I think we've been very neglectful in that.
And lastly, you spoke about employment, and that's something I wanted to follow up with. When people have fairly serious issues, it is sometimes hard to employ them, and it is sometimes difficult to find them jobs and for them to keep jobs. So how would you support both employers who are not always equipped to deal with those kinds of issues and the people who are maybe struggling with keeping that job?
Well, I think the nonprofits that train workers are our foot soldiers on this. Cognitive behavioral health therapy, we use it at Uplift Workforce. My wife and I started that. We have an incredibly good outcome with people that have really severe difficulties. And part of it is teaching people how to succeed at life. That's very important. Part of it's having a caseworker to navigate all the life's challenges like housing, daycare, transportation, negotiating with probation and parole, opening a bank account. If you have a record, it could be difficult. So if people have an unlimited number of burdens, of course, it affects you. You take away the burdens and watch them blossom.
Thank you. Helen Gim, you're next. So again, what is your overall thinking on this topic?
So my overall thinking is that we are a city that often does things based on what agencies spend and how they operate, and not based on what people need. I've been very clear from get-go. I'm on city council in large part because there were schools. I saw children die in schools without school nurses. And when I got onto city council, I made sure to turn that around. When we were dealing with a situation with like so many schools in need of social workers, talked with CBH about using their reinvestment dollars to actually put social workers back into our public schools so we could have social worker programs and STEP programs that integrated counseling, social workers, nurses, and an IEP specialist to work with communities and families so children could become stronger. We proved that we can do it. You have to have the vision that schools and every single place in our city need to be those hubs of resilience to turn things around. I made sure that, as we said, I do not think $1.6 billion is enough, honestly, in this city to deal with it. But here's what I will say. I believe that we need a vision for how each and every civic asset, especially our public schools, especially our rec centers where we can offer teen wellness programs, not just mental health therapy, which is like has a high threshold, but teen wellness programs on a day-to-day basis can be offered out to communities and young people in need, to put all those assets on the table. And then we should be leveraging in partnerships with our private hospitals, with federal government anti-violence dollars, to be able to expand the possibilities for how to grow budgets, because we do actually have to turn things around. We're not spending the money the right way. We need to expand, grow, and invest in people. That's how we're going to create stronger families, stronger parents, and stronger children.
So again, it sounds like a pivot toward prevention in a big way, focusing the effort on prevention and prevention early.
Yes, absolutely. And, it's not just on, this idea of prevention, it's intervention right away as well. When there was a shooting outside of Blaine Elementary School a month ago, almost 30 bullets went off, 6 children were hurt. A mother was shot after trying to pick up her child from daycare. Many of these problems are happening before 6 p.m. The very next day, there should have been a full outreach to all those children and families. Those young people should have had support services that go with them, not just for the day after, but actually for multiple times afterwards. Communities and young people are experiencing concentrated amounts of violence. That's something that the 57 Blocks Initiative has taught us. And thus, we have to reverse that by creating hubs of resilience, places where these things are ingrained and entrenched, not just rushing in to be reactive in the aftermath of tragedy, but are present and are supportive. That is also how we intervene but prevent.
Very quick follow-up. In your mind, what fosters resilience? You've said the word several times. So what makes children, what makes people more resilient, and how can we help them?
What makes people resilient is a whole city that embraces and envelops them. That is what we have failed to do. We've failed to invest in schools that are open after year-round, that are not open late at night. A child that is experiencing violence is so much more likely to have a school that is falling apart, a library that's closed on the weekend, and a rec center that isn't even open. More likely to walk by vacant lots, more likely to walk down a dirty, an unlighted area. This is the business of government. And so government has to get down to business. We've got to be able to reorient ourselves out of City Hall and back into the neighborhoods and communities. It's the thing that I have led and driven on for more than 20 years. This is not just talking about a public health platform for 2 weeks. I've taken on situations where schools didn't have nurses and we turned it around. I've delivered social workers for schools. We did a crisis response effort with mental health crisis responders taking 911 calls instead of police departments. We can turn our city around to be those places that are both meeting people's needs, but also creating stronger, healthier communities.
Thank you. All right, now we're going to turn to Alan Dom, if you could share, thank you, and then Derek Green. So Alan, you're first.
Thank you. Someone once told me, actually, Jay Lamont from Temple's Real Estate Institute said to me, when you steal one idea, it's plagiarism. But when you steal many ideas, It's research. So I have 4 ideas of research I'm going to share with you. 1, utilize an empathetic and results-oriented approach. That 1, expands access to mental health services and addiction treatment. 2, get people off the street. 3, get the people that we get off the street the support they need to be stably housed and maintain housing. Second idea, create a 24-hour access point in each geographic area of the city to help the most vulnerable and participants with co-occurring disorders of substance use, mental health disorders, and housing issues. They would offer multi-level services. This would be 24/7. They'd be staffed with a psychologist, social worker, case management services, plus security. The goal is therapeutic services on day 1, ground floor, to assess and then assign participants to the correct treatment, housing, therapy, and community supports. Here's the third one. Create a comprehensive, streamlined, seasonal weather emergency and public health emergency plan for the unsheltered, who often have substance abuse, and we've seen this on the street, and behavioral health issues. There's more, but I'm just going to give you one more. We need to make sure the service providers, no one's talked about that, are well for the duty of this job by creating trauma-informed work environments that focus on the employees' wellness so the staff can thrive personally and professionally as they do this work and help this population. It's a very difficult population to work with. Thank you.
And how would you fund those ideas that you have mentioned? Does this mean reallocating dollars, finding new dollars? How would you do this?
I would say it's probably reallocating. And when I hear the story of funding, I think to myself that the city's budget 8 years ago was about $4 billion. Today it's $6 billion. It went up 50%, 50% in what, 8 years. So there is money there, and I have found a lot of money in our budget. So I know there's funding for this, that we could accomplish it.
Thank you.
Well, this question is really interesting because the example of why it's so important that when we select the next mayor of the city of Philadelphia, it should be someone with a specific learned experience, but also career experience, especially in the issue of the question just asked about. It's laughable to say that we have enough money in our budget to fund and address the issues we're talking about. Yes, we can do things a little more efficiently, but historically, and I'm the past finance chair, also served in the Public Health and Human Services Committee, the money that comes for Department of Behavioral Health, Intellectual Disabilities, which then go to CBH and the Health Department, mostly has been about the same level for years because those dollars are not general fund dollars. They're grant dollars coming to the city of Philadelphia, which is going out to provider contracts. And when we think about the fact that COVID-19 has had such an impact on behavioral health in our city, we're asking our providers to do more with less. The cost of providing those services, the cost of bringing in staff to do that work is going up. But the amount of dollars we've given to our providers to do this work has been about the same. So of course, we're not getting the same level of services that we need because the providers don't have the dollars that they need. What we need to do is not just talk about a lot of these great ideas, but how will you fund them? It's a behavioral health crisis, not only here in the city of Philadelphia, but around the Commonwealth. Now, I'm the past president of the Pennsylvania Municipal League, and I've talked to mayors all around this Commonwealth. The issue is not just here in Philadelphia, the issue is in cities all around the Commonwealth who don't have the resources that they need coming from the Commonwealth to address these issues. So as mayor, I will use my experience and lived experience as a father with a son on the autism spectrum who know all the different acronyms I've had to learn from TSS and BSC and IEP and learn a whole new language, but also understand the funding issues that these organizations have. And I'll lobby Harrisburg and working with mayors all around this Commonwealth to get the additional dollars that we need to make sure that our providers can provide the services that we need in our city. Because when I say Philadelphians should expect more and deserve better from our city, it's from that perspective. And it's not only a state issue, it's also a national issue. And I was president of the national president, Democratic municipal officials and cities around the country are having the same issue. So we also need to lobby DC as well.
Now, follow-up question for you. You have mentioned that you know this issue, not just in your role as a politician, but also as a father. So if you could maybe give us an example of something that has been extremely frustrating in getting services for your son and how you would change that. How would you approach that?
Well, we have to have a much more interdisciplinary approach in reference to how we provide these services. I remember my son was first diagnosed and we get the services. You go through the school district, you're doing an IEP. If you're blessed to be able to get a developmental pediatrician, you're dealing with another plan. And then you're also dealing with your primary care physician. And it takes a scientist, someone that with a lot of degrees, to be able to integrate all those perspectives to make sure you're providing the best education and behavioral health for your child, but also you know your child the best as well. So how do you synthesize all these things? My wife is much smarter than me. She works at Children's Hospital of Philadelphia. She's helped develop healthcare IT systems all around the country and also internationally. But we had a struggle to understand all these new acronyms, like I said earlier, BSC, TSS, and what does that mean for our child? And also understand we know our child better than anyone. So be able to articulate back to a developmental pediatrician or to the school district in reference to the IEP, if you're getting the supports for that IEP, it's really difficult to synthesize all this information when you're struggling as a parent to understand what is this learning difference called autism. So we need to make sure we have a better coordination between the school district as well as developmental behavioral partners and developmental pediatricians to help focus all those issues. We've tried to do some of that work through the Philadelphia Autism Project, but we need to expand it even more for so many people and so many households who are dealing with this issue. So my son just turned 22 January of last year, and so many other young adults will be transitioning and will aging out of services. And the perspective that so many people give is like falling off a cliff. Because at least when your son or daughter is in a primary school, you have services. But once you get beyond that, you really have to struggle, even more challenging than learning all those acronyms to be able to provide those services from 22 until they transition.
Yes. Thank you for that. And now we're going to pivot to your questions, which have come to me through my computer. I'm just going to hit refresh real quick on this document. And I have behind my computer a pile of names. And the way we're going to do this, I'm just going to draw a card. I'm going to read a question and then assign it to you based on the cards that are here. All right. The first question is, and I don't know who they came from, so thank you for submitting them, but I don't have names attached to them, okay? So what would you change about how the city's anti-violence programs are funded? All right. Here's our first question. That goes to Alan Dom. What would you change about how the city's anti-violence programs are funded?
Well, I actually put in a resolution back in December of 21, supported by all members of council, asking the administration to evaluate the $200 million at that time of the gun violence prevention programs that we were investing in. And I asked the administration to have academic institutions and nonprofits to do that evaluation, because there's not one person in this room who would invest $200 million and not check to see if it's working or not as to what's saving lives and what isn't. It never happened. It was passed through council unanimously. You know, people say stuff about council. Council did their work. The administration did not follow through. It was the administration who did not follow through on this. But we found out recently in the paper that like group violence intervention does work, and we need to put more money into GVI. But we found out some other programs that did not work, and we're wasting money. We need to do it for the whole evaluation of the whole $200 million. We probably need to do it for the whole budget of the city. Evaluate who spends this kind of money and does not evaluate.
Thank you. And again, I'm going to ask the candidates to keep their answers to 2 minutes or under, okay? So we'll get through a bunch of these questions. All right. So our next question is a little bit longer. Okay, here it goes. It is more important than ever to have a comprehensive network of qualified providers to meet the behavioral health needs of our most vulnerable citizens. But the city is facing the greatest workforce crisis in the behavioral health field that we have ever experienced, particularly in services for children and individuals and families impacted by autism spectrum disorder. As mayor, what will you do to attract and develop a workforce to address this growing crisis? So this is obviously an issue we have touched upon a bit in our conversation. And now who's going to answer this for us? David O. So how would you grow the network of providers and have that workforce at the ready?
Well, I'd have to look into the situation. I can say that I would assume that many people do not want to work in our city because of violence. They don't want to live through the violence and fear. It has to be a safe city. I imagine a portion of that has to do with the quality of work that they're doing, how worthwhile their work is, how they feel rewarded. A portion of that is what kind of pay are they getting. And if we're talking about underfunding of service providers, that affects the people and what they think they're doing. They're going to greener pastures where they can do more work, feel more worthwhile, live a better quality of life with their family and loved ones, and do those things, right? So from a mayoral perspective, we have to look at that and see what is the exact needs of our city. What are we taking on that we don't need to take on? For example, when we talk about Kensington, we're attracting so many more people here that we cannot handle, cannot sustain, can never service. And what they're leaving behind is all the money, resources, families, and people who care about them, because as drug addicted people, they can live a lawless life in our city to their detriment. So there's something that we must do. Then we have to look at how the city funds that around a priority of missions, and to ensure we're working through various budgets, including the school budget, the city's budget, and other things like that, and grants of money. And then, yeah, we have to increase where our money comes from, and we have to look at certain things. Sometimes it's pay incentives, sometimes it's tax incentives, and other things like that, to really hone in on who we're trying to bring here and what opportunities lie for them if they base their careers in our city.
Thank you. Next question was a question that was long a lightning rod in the city, but now it's gotten a little quiet around this issue. Do you support safe injection sites in Philadelphia as a way to reduce harm and prevent overdose deaths? If so, how will you go about building community support? If not, what strategies would you employ in its place? And that question will go to Helen Gim.
In 2017, I supported an effort around harm reduction. I visited multiple sites around the world to take a look at how it's done. I've been to places far-reaching from Copenhagen to Toronto, and they've been diverse. To me, harm reduction is an important part of a spectrum of care. It's not a single answer, and it is not the only thing that will solve any issue. But right now, I've been very clear that every single street corner, in front of schools, in front of homes, is an unsafe injection site where people and other children are witnessing horrifying incidences of people committing harm to themselves, who are dying in our streets, and it is shocking. But I am also very clear that cities and communities have to have buy-in. The city made a terrible mistake, I feel like, in 2017 by making an announcement about something most people didn't understand and had never seen before. And it created tremendous fear. And I think we are in the place that we are with a lot of reactionary situations around it, and no better advancement in how we are handling the problems within communities, or whether we better understand harm reduction. So my belief right now is we need to focus in on communities. We need to focus in on neighborhoods being reclaimed for neighbors, that it's extremely important that there is community buy-in and a focus in on the resilience and care of neighborhoods, because I do not see any other practices really moving forward unless we do that in a bold and clear way. And I'm also very clear that we need to really invest in people who are reflective of communities, that this is not something that comes in from the outside and is pushed upon neighborhoods and neighbors. This is a whole city mission to bring people back to life, to save lives first and foremost, and to make sure our neighborhoods are restored.
Thank you. Our next question is another topic that we all thought about a lot. This is like giving me flashbacks from my reporting days. So this question is about the soda tax. If City Council voted to repeal the soda tax, would you sign that bill? If so, how would you then fund programs such as pre-K childcare and early childhood development? So this question goes to Jeff Brown. I swear I did not make this happen.
That's a little suspect.
I know. Sorry. I just reached into my pile.
So the new mayor is going to have at least a $250 million budget gap, because we're not getting the federal stimulus is running out, and we're probably going to be in a recession that will repress revenue. So as a mayor, I wouldn't initiate that. But if it is the will of the council, I also wouldn't stop it. But I would want to understand where we're getting the money from. So Yeah, you know my feelings about the beverage tax. I think it's a tax on the poor. We tax the poor a lot here in the city. We're one of the worst cities in the country for taxing the poor. You talk about all the problems of the poor. It just doesn't seem like the correct way to handle it. On the other hand, I'm absolute advocate for pre-K. I think we need to expand it from roughly 4,000 slots to get all 15,000 kids in there as you can. We got to get the kids to read. I do like what we've done with rec centers, except for I'd like to do it quicker and touch all the rec centers. So I'm not moving away from the programs, but if the city council demands change in any area, I have to be cognizant of that if I'm the mayor.
Thank you. Our next question speaks to young people, something we've hit on a lot during our conversation tonight. DHS is struggling to care for young people with serious mental health problems who end up in the child welfare system. What needs to be done to better support these young people? And this question goes to Rebecca Reinhardt.
So the issue of children that need care is incredibly important. And as mayor, I would put much attention on DHS to make sure that it is providing good support services, that it is well run, that the children in our city, the most vulnerable children, are getting helped in the way that they need to be helped. Because when family fails a child, in cases of abuse and other instances, it is extremely important that government does work. With that said, I also want to make sure that DHS is working properly so that children aren't taken from homes for financial reasons, that if there needs to be money for a bed or something like that, that we're providing that to keep families intact. So those are some of the things that I would look at in terms of DHS. And as mayor, I would troubleshoot the issues that arise. If there's issues that are arising with providers, with the CUA system retaining staff, then I would work to ensure a program and process for fixing that. Because the mayor is the leader of this city and must take responsibility for all of the departments, including DHS.
Thank you. Our next question. Public health experts are recognizing more and more how important civic engagement is to the health of a community, affecting policy decisions relating to all of today's topics and more. Given that voter turnout in Philadelphia is declining, how do you plan to improve civic engagement, especially for historically disenfranchised communities? So that question goes to Derek Green.
So first, I just want to correct the record. The soda tax was not a tax on the poor. It was passed on to the poor by certain business owners. But how we get civically more engaged in the community is we do things like some of the things I did in city council, like campaign finance reform, the ethics legislation I've done to really address the fact that we need to make sure we have a transparent process. When I say Philadelphians should expect more and deserve better from our city, they see a city where they don't feel they're part of the process. I mean, actually today in Chicago, there's a runoff. Now, I also did legislation regarding ranked choice voting. Now, we can't do that here in the city of Philadelphia. So I talked to my friends in the General Assembly to start talking about ranked choice voting because that's a way to get more people engaged. So the ethics legislation that I've done is ranked choice voting. It's public financing of elections, making sure that regular people can actually run for office. And these are all some of the things that get people more engaged in the political process, because it's about we, the people. It's about the citizens. And we need to make sure we have a process to allow more citizens to participate and actually run for office. And that's some of the legislation I've done. And as mayor, I will continue to push for those same ethics reforms, as well as campaign finance reforms and other ideas, and using my statewide leadership to also talk about the issue of ranked choice voting, and hope we can bring those ideas to the city of Philadelphia so more people will think they can participate in this electoral process.
And if you can find somebody who can explain ranked choice voting in a paragraph or
I
less,
can do that. If we can
bonus
do it.
points. All right, we'll do that another time. So our last question by default will go, but just so everybody sees it, go to Warren Bloom. So
Thank you, Jeff.
yes, so the question for you is about the Rebuild program. What will be the role of the Rebuild program in your administration, given its focus on mitigating violence by improving communities? Will you keep this program to revitalize the city's parks, recreation centers, and libraries, or would you phase it out? So what's your take on the Rebuild program?
I would keep the Rebuild program and add to it. Like I said before, I want to make this a world-class city. I'm going to use Atlanta as an example. As I said before, we do not have enough hotel space in this city. We need more homes, a low-income housing, and hotel space to make this a world-class city. Building more hotels will create jobs. It'll eliminate homelessness. Building 3D housing, which you can do in 24 hours. We will build under the Bloom administration, provide jobs we need. And I didn't, just in case everybody didn't know who I am again. My name is Warren Bloom. My slogan is Bloom in the spring, do the right thing. I'm from the hood, I'll do you good. That's for another demographic, but long as you got Bloom in the spring, do the right thing, you got it. Build under the Bloom administration.
Thank you so much. With that, I'm going to close out this part of the program, and I want to thank our candidates for being here, for all sticking to our timing rules, and for doing such a wonderful job collaborating with the microphones and everything else. And now I'm going to welcome to the podium Donna Bailey, who is the Chief Integrated Health Services Officer, and of course, a longtime servant in the city of Philadelphia. So without further ado, I'm going to pass on the microphone, and thank you all for allowing me this opportunity.
Thank you. Great job.
Thank you.
Sure. Good afternoon, everybody. It's so good to see all of you. I'm Donna Bailey, and on behalf of my colleagues here at PHMC and our board members who are here with us this evening, a hearty thank you to Maiken for facilitating such a rich discussion, and a thank you to all of the candidates tonight. We really have enjoyed digging into some of the most pressing topics that are facing our city right now. So I think we all agree, and we've heard tonight, that there are unprecedented challenges facing the city. I think we all have heard a very strong commitment to working together with government, with providers, with stakeholders, and with communities to really look at a holistic strategies and sustainable strategies to addressing those challenges. Here at PHMC, our core mission is creating and sustaining healthy communities. So we are really excited to be a part of the discussion and a part of the solution. And we look forward to working with all of you into the future to better our city. So once again, thank you to all of our candidates. Thank you to our attendees here in person and via live stream for all of your questions, which contributed to a rich discussion. And so I am standing between you and some refreshments out there. So please stay, mix and mingle, and continue the discussion. Best of luck to the candidates, and have a good evening. Thank you.